Hi everyone! Welcome to this lesson where we'll be exploring some of the unexpected or unusual signs and symptoms of celiac disease. What makes this particularly interesting is that these are what we call extraintestinal symptoms, meaning they happen outside the digestive system, which can make celiac disease tricky to identify. But before we dive into these weird symptoms, let's quickly recap what celiac disease actually is. What is celiac disease? Celiac disease, also known as gluten-sensitive enteropathy or celiac sprue, is a condition where the body's immune system mistakenly attacks the small intestine. The key word here is autoimmune, meaning the body's defense system is mistakenly attacking its own tissues, in this case, the small bowel's mucosa. This damage causes malabsorption. Basically, the body can't absorb nutrients properly, which leads to symptoms like changes in bowel habits. But what kicks off this immune attack? It's triggered by a specific part of gluten called gliadin. So, when someone with celiac disease consumes gluten, their immune system goes into overdrive, attacking the small intestine, particularly the proximal part or the duodenum. Now that we know what celiac disease is, let's talk about the usual symptoms like abdominal pain, diarrhea, and weight loss. But the real focus of today's lesson is on the more unusual or hidden symptoms that aren't as well known. 1. Anemia. One of the less obvious signs of celiac disease is anemia, which affects about 10 to 15% of people with the condition. Anemia happens when there's not enough hemoglobin in the blood. In celiac disease, this occurs mainly due to inflammation of the duodenum, the part of the intestine where iron and folate are absorbed. Without enough of these nutrients, your body can't make enough healthy red blood cells, leading to anemia. Severe cases can also affect vitamin B12 absorption, and gastrointestinal bleeding may worsen the issue. As a result, patients may experience symptoms like fatigue, paleness, shortness of breath, and rapid heart rate. Fun fact: one odd symptom of iron deficiency is a craving for ice. Yep, ice chewing is a thing. 2. Mouth signs and symptoms. Another unexpected area affected by celiac disease is the mouth. Iron deficiency can cause angular colitis, canker sores, and smooth, inflamed tongues. It's amazing how nutrient deficiencies can reveal themselves in such subtle ways, isn't it? 3. Vitamin D and calcium deficiency. Moving on to vitamins and bones. Because of the damage to the intestines, people with celiac disease often struggle to absorb vitamin D and calcium, which can lead to conditions like osteopenia and osteoporosis. Long-term untreated celiac disease can really take a toll on the bones, especially in older adults, increasing the risk of fractures. 4. Neurological and psychological symptoms. This is where things get really interesting. Low levels of vitamin B12 and calcium can cause symptoms like depression, memory issues, and tingling sensations. These symptoms can sometimes be mistaken for conditions like dementia, especially in older patients. If left untreated, the damage caused by these deficiencies can become irreversible. 5. Dermatitis herpetiformis. Here's a unique one. About 10 to 20% of people with celiac disease develop a skin condition called dermatitis herpetiformis. This itchy rash appears in spots like the elbows, knees, and scalp, and its appearance is a telltale sign of celiac disease, so much so that if you see it, a diagnosis of celiac disease is practically guaranteed. 6. Reproductive system dysfunction. Finally, let's talk about how celiac disease can affect reproductive health. In women, nutrient deficiencies can lead to delayed menarche, amenorrhea, and infertility. Men aren't off the hook either, as celiac disease can cause issues like impotence and infertility.